And I want to welcome everybody to our second presidential address of the conference. I'm Abby Fagan. I am the president of SPR, and I'm also a professor at the University of Florida in Gainesville. One of the great things about being president of SPR is I don't have to give my own formal address, so no pressure on me. And I get to invite two speakers from organizations or agencies or researchers or practitioners who are doing work that I admire and want to know more about. And yesterday we were privileged to hear from Lindsay Barranco from the Centers for Disease Control talk about her work with the Division of Violence Prevention. And this afternoon, I'm very excited that we have Dr. David R. Wilson, who is the director of the Tribal Health Research Office. And Dr. Wilson has a PhD in molecular and cellular biology from Arizona State University. He completed a 3-year postdoc and served as a senior research scientist at the National Institute on Aging. And he currently also serves as an adjunct professor at the Johns Hopkins School of Public Health at the Center for American Indian Health. The Tribal Health Research Office is a fairly new one at NIH, and it was created, I believe, in 2015 to recognize the importance of ensuring meaningful input from and collaboration with tribal nations on NIH programs and policies. And as the director of THRO, Dr. Wilson brings together representatives from the NIH institutes, centers, and offices to leverage trans NIH resources and build collaborations through the research portfolio to address tribal health concerns. He also works to build a unified NIH presence with which to engage and ensure input from tribal leaders across the nation, and aims to expand training opportunities for American Indian and Alaska Native communities. Please join me in giving a warm welcome to Dr. Wilson. And I will say we hope to have a few minutes at the end for Q&A. Thank you.
Thank you. Going to take this off for a few minutes. So thank you so much for joining us today. It's a pleasure to be here. I'm so glad that I was able to travel. As you know, the status of the COVID-19 infection across not only the country, but the world is very unpredictable. And we just really know what direction it's going to go these days. But what I would like to share with you is more about what our office does and some of the important work that we're doing for American Indian and Alaska Native communities. But first, I'd like to set some context and set the stage about where we're at. So I'm in the office of the director at the National Institutes of Health. And as you can see here, our mission is to improve, enhance health, lengthen life, and reduce illness and disability. And going into that, prevention research plays a huge part of this. And one of the things that we always say, and we've always begun to highlight, is that it seems like in the research field, in the biomedical field, that the preventative research part, it seems like it's always the last car on the train that we always visit, when it actually should be the first car on the train. And so we're really slowly getting there, I think, in terms of how we think about research and how we develop interventions for many tribal communities. You can see here the NIH is the world's largest funder for biomedical research. Here the number is about 41.7 million. It's around 43 billion, sorry, billion, not million. And a large part of this goes to extramural funding. So all of you academic researchers in the audience there receive a huge part of this funding. Over 80% goes to extramural funding. And a very, very few percentage of that goes or stays inside at the NIH, but over 2,500 universities are funded. And what our goal is also to increase the number of tribal colleges and universities that are able to receive that funding as well. And I'll talk a little bit more about that in my presentation. But where we sit in the Department of Health and Human Services here, you can see the NIH is one of what is called an operating division. And you can see a lot of our sister operating divisions that we work very closely with. Those include the Indian Health Service, the Center for Medicaid and Medicare Services, the Center for Disease Control and Prevention, who you heard from yesterday, a very large agency that does a lot of important work as well in terms of public health. HRSA, SAMHSA is another key player that we work closely with. So it's really important to understand that each of these different operating divisions have their own mission and scope. So without partnering, we would not be able to have the more comprehensive approach to problem solving health disparities in tribal communities. So looking at the operating divisions, now let's take a closer look at the NIH inner structure itself, or how this looks. So you can see here the Office of the Director, and there are 27 institutes and centers at the NIH. All of them have a very specific mission as well. Most of them are disease specific or organ specific, like the National Heart, Lung, and Blood, the National Eye Institute. Our office is located in the Office of the Director, and Dr. Murray's office, the Office of Disease Prevention, is also located in the Office of the Director. We're strategically placed there in the Division of Program Coordination and Strategic Initiatives, specifically because our offices have trans NIH engagement or missions. So we engage and we collaborate within all the 27 institute centers and offices at the NIH. And our goal is to help synergize and coordinate the research that happens in tribal communities. So now that I've given you a little bit about the lay of the land, about where our office is and where we're at in the federal system, I want to talk some more about some of the issues or some of the things that we have to consider when we work with tribal communities or tribal nations. And this is something that we've begun to do, and it's an ongoing process, is to not only educate the external scientific community, but also our internal agencies and our sister agencies as well, because there's a lot that people don't know about tribal nations. Some of the things here that are really important and key is that between tribal nations and the federal government, there is a government to government relationship, and it's very different. It's based on a political status and a legal foundation. It's not based on a race or ethnicity. And that's something that we all have to really, really recognize. That's what separates us apart from all the other communities in the US. There are also a tremendous amount of diversity of tribal nations. There are 574 tribes out there currently. There are about 66 plus other tribal communities trying to gain their federal recognition. So going through that huge process to become a recognized tribe. But I think what's also important is that to honor the government to government relationship, there's something called the consultation process, in which we use and we operate with, which is a formalized form of communication with tribal nations. And I'll talk more about how important our tribal consultation policy or process is to the NIH. And you guys should think about this as well as about your institutions. Do you have a standardized process about how you engage tribal communities? And if not, it might be worthwhile to think about formalizing that process so that it's consistent across your institution. And that's something that is also really important, is about the accountability of academic institutions and the grantees that we fund about their role in conducting ethical research with tribal communities. So talked a little bit about the government to government relationship, and a lot of folks are really curious to what is the spatial distribution of tribes. And here you see a map that's very common to us who work in tribal communities. This is the IHS service area map. So it shows where IHS provides service. And if you ever talk about the Nashville area, people who work in tribal communities will immediately recognize that you're talking about a majority of the Eastern Seaboard. Or if you talk about California, you're just talking about California itself. But you can see there that there's a tremendous number of tribes that are in California and in Alaska. I think that number really catches a lot of people by surprise, that there are 231 Alaska villages in Alaska. Then that's a huge portion of that 574 number. So it's really important that we think about all the different communities that we're serving, the diversity, the government structures, and their cultures and traditions when we think about engaging tribal nations in biomedical research. So something I think that we've all bared witness to over the last couple of years is there's been a tremendous change in the landscape of our country and in our society as well. And a part of that you can see here is that the current administration has really put a lot of emphasis on increasing our government to government engagement with tribal communities. There's a process that has been reaffirmed through executive orders by other presidents, but this has really been one of the big priorities for the current administration. But not only is there priorities in the administration, but we've seen other issues like social justice issues come to the forefront that have really put tribal communities and underrepresented communities at the forefront of why are these lingering disparities, or why do they persist in our communities, in our country? And so right now there's a tremendous effort that's ongoing at the NIH. It's called the Unite effort to identify structural barriers that are prohibiting or hindering underrepresented communities from participating in biomedical research, whether those are policies, whether those are the way the funding announcements are written, how are we bringing in talent into the agency? All of these things are under consideration that will help us change and diversify the agency as a whole. So it's a really important effort. I was an absolute pleasure to be a part. I didn't even know I was going to be included in there, but it's a great picture. I love being included in this effort. But this is an ongoing changing landscape. It started in 2020. It continues to today, but also not only are things changing in our society, but also in the court systems as well. You can see here that the Supreme Court made a really important ruling in 2020, in July and mid-year of 2020. And the underlying statement here that I want to make is that the Supreme Court reiterated that the tribal rights, sovereignty, and jurisdictions, these are coming to the forefront in a way that they've never come before. And here they made a ruling where they acknowledged that all of those lands that you see in different colors remain tribal lands because of treaties that were signed in 1866. So this is a reaffirmation again around sovereignty and the importance of recognizing sovereignty of tribal communities. So a little more about what I was talking about in detail with the Presidential Executive Memorandum. Here you can see what the administration has really encouraged and mandated actually all of the federal agencies to do is to strengthen our engagement with tribal communities. And so by doing this, we've been holding many of the consultations that I have talked about. And these are enhanced forms of communications where we bring together the highest levels of tribal government. Many of those are elected tribal leaders, and also the highest levels of federal government leaders. And we come together and we have conversations about programs, policies, or initiatives that are deemed to have significant impact to a tribal community. And a consultation can be initiated by the community itself, or it can be initiated by the federal agencies who are developing these programs and feel like they might have enough significant impact to be brought to consultation. So this is a really important effort. It's continuing to build upon. Each executive memorandum builds on and strengthens the government to government relationship that we have with tribes and the federal government. So I know that this next slide will be very familiar to you because you've heard about this earlier. You know, Dr. Stinson and the SEAL program talked about the importance of moving at the speed of trust. And this is something that we also very much communicate to all of our partners across the agency. It's really important that we need to take time. And sometimes biomedical research doesn't facilitate taking long periods of time. You think about how much has changed in the past 2 years with the COVID-19 pandemic. Things happen so quickly. One of the great things about this is that the tribal communities that we worked with really stepped up and they responded immediately to the COVID-19 pandemic. They reached out to us and they said, Dr. Wilson, we want to have a conversation. We're inviting you to Tribal Council because we want to hear about everything that's in that clear vial. And what's the data? What are the side effects that you're seeing through research so that we can have more confidence about encouraging our tribal community members to be vaccinated? So I'll show some slides where this was a tag team effort between Dr. Fauci and myself, where we really did a tremendous amount of engagement across the country with many different tribal communities. And it was very well received. And I'm hoping that a part of our efforts really led to tribal communities having the highest vaccination rates of all other ethnic communities in the country. That we played a small role in that, but I'm really happy to say that we really did this. Something else that we're really working on at the agency is trusting relationships. So tribal communities haven't always had the best experience with research, and we have to acknowledge that. And we have to put that up. But one of the things I encourage tribal communities to do is let's acknowledge that, but let's think about how we move forward, because we can't get stuck in that cycle of revisiting the past over and over again, because it won't lead to future progress. It won't lead to future participation in research. It won't lead to interventions being deployed in communities to save lives or to make our community members' lives more fulfilling. So another thing that we also really take to heart is that the communities that we partner with, they have to be truly partners. You know, we can't come in and design a program or a study and say, this is going to be your role, and dictate to them what's going to happen. But not only that, is that we have to go into communities and ask them, what are your research priorities? You know, what is the top of the list for you? We can all go to the CDC list and identify the top 10 health disparities or the social determinants of health that tribal communities are facing, but those don't always resonate with communities. Some will prioritize mental health, some will prioritize substance misuse. So it's really important to recognize that. And that's how you'll get more participation from the communities when you engage them in research. So I talked about the history, and I want to kind of frame this more around some of the preventative health research. So people always ask you, or there's a lot of conversation about why are there so many challenges with tribal communities? And this can all, well, much of it can be attributed to the history of how America came together and was shaped. You can see here that in 1960s, in the mid 1940s is when uranium mining began on the Navajo Nation. And that persisted for a little over 20 years. But as a result, there are over 500 to 1,000 open uranium mines. And that has created an environmental disaster for that community. And it's impacting the communities in so many different ways. So how do we prevent that? Well, because it's already happened. Some of the other things are that are really challenging for tribal communities is that we don't have reliable broadband. So how do we develop really accurate and real-time, up-to-date information and get it out to the communities that don't have access to the internet or reliable access? So these are all really important issues. Then this slide here of the map really highlights and talks about the food deserts that exist in our communities. So the darker the color, the less food is available, the greater the scarcity of food is in these areas. And as you can see here, many of the central part of the US is where many of our tribal communities live. That's a big challenge there as well. Also, there are barriers to healthcare. And I think that this is something that we work closely with the IHS. So how do we develop better interventions so that they can improve the delivery of healthcare that the IHS, the Indian Health Service, is responsible for? So that's how we're partnering with a sister operating division. So those are some of the challenges, but now I'm going to shift a little bit and talk more about our office, and then you'll be able to see some of the things that we're doing and how they relate to preventative research. So as Dr. Fagan said, that our office was created in 2015. I was appointed the first director in 2017. And you can see that our office serves as the single point of contact for all 574 tribal nations. So whenever there's an issue around funding, or if there's a health concern in the communities, we get those inquiries and then we direct them to the appropriate source, or we go out and visit the communities and have conversations about what are the interventions or what are the resources that are necessary for these communities to help address this. We support NIH-wide efforts. So NIDA, NIMH, OBSSR, and others who fund this conference, we work closely with them. We have what's called a Tribal Health Research Coordinating Committee, where the director of each of those offices and centers has appointed a member to sit on a trans NIH committee that I chair, and we have conversations about what's going on and how can we work together to increase our impact together for tribal communities. Our office also is in charge of making sure that we have that standardized and uniform approach to tribal consultation. So March 13th of this year, is when we released the first NIH tribal consultation policy. And it was a long overdue because it's a policy that is very focused on biomedical research. And that was the importance of it. We followed a general template that was HHS wide for a long time, but that wasn't really specific enough for the research that we support. So the tribal consultation policy has really been an effective tool, because one of the things that I want to do is I want tribal communities to say, the NIH is holding consultation, and as a result, during their fifth step of their process, this is exactly what's going to happen. Doesn't matter which institute or which center holds a consultation, they will all be doing the same thing. And that's really important for tribal communities. Gathering input from tribal communities. I talked about going to communities and visiting, or providing resources or input, technical information when necessary. But we also we receive a tremendous amount of direction and input from our NIH Tribal Advisory Committee. So many of the institutes at the NIH, they have what are called councils. And many of you may sit on councils at the NIH, where you help advise that director on what research should be funded, where's the field headed, what are the needs of the country. This is exactly what this Tribal Advisory Committee does for tribal communities. And they provide us direction and recommendations on what are some of the topics that should be brought to consultation, and what are the things that we should be focusing on in the future. So I talked about our office, and these are some this is just a very, very limited picture of what our office does as we partner with institutes at the NIH and some of the problem solving that we engage in. So you can see here that we've worked with institutes like the National Center for Advancing Translational Science, or NCATS, on developing a COVID-19 cohort collaborative. It's called N3C. We took this to consultation, and what we're trying to do is to provide as many opportunities for tribal communities to participate in these emerging cross-cutting research efforts as possible, or as many as they choose to participate, as they want to participate in. Not all of these programs are going to be suitable or attractive to tribal communities to participate for one reason or another, and that's okay. Our goal is to provide that opportunity for the tribes to say, if you just modify this a little bit, or if you make this exemption, we would love to participate. And that's our goal, is to give them that, extend them that opportunity. In HLBI, many of you may have heard about the Strong Heart Study, a long-standing cardiovascular study in tribal communities. Something that was really important that we've participated in last year was the consultation for the National Institute of General Medical Sciences. And this was for the Native American Research Centers for Health program, the NARCH program. This was a very eye-opening experience, because a lot of the institutes were a little hesitant to participate in consultation. But Dr. John Lorsch, who directs NIGMS, said, let's do this, let's see how it goes. And through their participation in consultation, they received so much valuable feedback from tribal leaders that much of that was incorporated into how the new NARCH program will look in the future. And some of those things that were never thought about before are providing sustainable resources for tribal IRBs, providing resource centers for tribes that want to write NARCH grants but don't have that capacity. So having those resources available so that a tribe could jump in, learn how to do this and learn how to do it well, and then be on their own. And so those are just a couple of the many recommendations that were received by tribal communities that were implemented into this program. So just so much great activity. We work with NIDDK on research challenges. We also work with the National Institute of Neurological Disorders and Stroke on developing regional training hubs. And these are really important. We actually have one that's down the road, partnering with Yakima, and I believe it's called Everest Medical College, and they're a fantastic partner. The goal of these regional training hubs are to provide training opportunities to identify the next generation of American Indian and Alaska Native research scientists, but give them the opportunity to conduct research at home. One of the things that we were seeing is that when we brought students from different parts of the country, we were literally dropping them in the deep end of the pool. And not only were they overcome by the science and by everything at the NIH, but it was on the East Coast. It was a tremendous culture shock as well. And so what we want to do is to prepare them for the caliber and the level of research, the expectations in their home settings, and then give them that opportunity to make that transition to the NIH if they choose to do so in the future. So these are some of the cross-cutting efforts that we've had with our agency partners. But some of the things that we've done in the office have been absolutely paramount for us to beginning to understand where we were at as an agency when addressing tribal health issues. And so in order to do that, we developed and we released the first two American Indian and Alaska Native research portfolio analyses. So if you are interested, these are on our website, and they'll give you a very clear view of how the agency is investing its research money and which institutes are being funded, which parts of the country, which disciplines are being funded. This has been invaluable to tribal leaders because we've heard a couple of them from up in the Bemidji area. Bemidji, this will be a quiz that's up near the Great Lakes area. They actually reached out to us and said, Dave, we don't see any behavioral health research happening in this region. We want to have more in this area. What can we do to address that? So this research portfolio analysis has really been valuable, not only to us internally, but also to the communities. And we're getting ready to release, this is 2018, we'll release 2019 through 2021. We're taking longer snapshots because at the NIH, most grants aren't funded on a yearly basis. They're multiple year grants. So it makes more sense for us to do multiple years to get a better idea of how things are changing in the portfolio. So the portfolio was really important for us to identify where's the money being spent. But the next thing was now that we know how the money is being spent, how are we going to respond to tribal needs and requests? So what we did also is we developed the very first NIH strategic plan for tribal health research. So this is a strategic plan that is used by the entire agency. So all 27 institutes use this plan, and they develop programs, they develop initiatives, they develop policies that will fall into one of these categories. And we're capturing all of this. You can see that this current strategic plan goes through the end of 2023. We are in process of developing a comprehensive report that will show everything that the agency has done. And to date, I can tell you that we have over 500 new projects that have been developed and that fit into this plan. So the agency is really, really doing well in this area. But this is really important because you see this is getting ready to end next year. So we are going to consultation this year to have more conversations with tribal communities about what are the needs of the communities now. As we all know, COVID-19 has really changed everything about our lives. And so we want to make sure that what we put into the new strategic plan for the agency will be meaningful and important to the communities to help them get through what remains of the pandemic and how we live with it as an endemic. So you can see here the 4 pillars here: building research capacity, communication and collaboration, and expanding research. And then the 4th one, and I think the one that's most important, is the cultural awareness and the community engagement part. That without doing this with all of the other 3 parts of the strategic plan, they won't be as successful or as impactful as they need to be. So some of the examples of how we've done this, and I did mention creating culturally relevant and materials that resonate with tribal communities. You know, you can see here that there was a lot of misinformation about the vaccines. And up here in the upper right-hand corner, you can see that we tried to depict this by displaying parts of a car, that if you made 1 million steering wheels and you injected somebody with 1 million steering wheels, you would never have a fully functional car, right? Well, the same thing goes with the COVID-19 mRNA vaccine, is that if you built and you coded one particle, you would never, ever create a fully functional infectious virus particle. So that was really important for the communities to see that. And immediately they said, okay, that makes sense, because they can't become infected if they receive the shot. We've worked with close partners like Johns Hopkins Center for American Indian Health, where they did a lot of terrific culturally adapted messaging for communities. Did this for COVID-19, but also as we transitioned in getting kids back into the classrooms. Here you can see this was a slide where in the early on phases of the clinical trial process, is where we worked closely with the pharmaceutical companies to receive daily updates on what was happening and relay those to the tribal members who were interested in monitoring and potentially participating in some of these COVID-19 vaccine trials. So here you can see the Moderna, Pfizer, AstraZeneca, Janssen, these were all of the ones that were early on out of the gate. So not only were these forms of communication, but we also had to adapt, and something that we listened to some of our younger generations, our kids, our grandkids, was what do you listen to? How do you receive messaging and information? And a lot of them did it through social media platforms. So we adapted and we really began to leverage social media platforms, which have been very responsive. We have a tremendous following now on our LinkedIn page and our Facebook channel. But that all became a part of, and also the students who are interested in training opportunities also go to the LinkedIn site. So it's been a really valuable resource for us. So we're expanding and identifying new ways to engage tribes and different age groups within tribal communities through different mechanisms. But one of the things that gave us the first inkling to this approach was when we held this Facebook Live event. You know, Dr. Fauci and I had a conversation where we talked about some of the things that we had been hearing and asked him questions about how the pandemic was progressing, some of the side effects, all of these different things. And you can see here, this was just some of the metrics that were very, very early on. And these numbers have tremendously grown. So this is a platform where a lot of tribal communities get their information from. And it's been something that we're going to continue to use moving forward. So thinking about these different types of communication, we've also been thinking about ways to, how do we educate more tribal communities about the vast diversity of research that happens across the agency, right? $43 billion of research, that's a tremendous amount of research. So what we've been doing is having interviews with different institute directors and having conversations about what their research portfolio looks like for tribal communities and what are some of the resources available to them. Some of the big things that a lot of tribal leaders have reached out to us are about the mental health issues that we're seeing develop and really take off in a really bad way in tribal communities. And then we also had an interview with Dr. Nora Volkow, who talked about the challenges of substance misuse and also how that is increasing to the morbidity and mortality of tribal members as a result of the COVID-19 pandemic. We've also had our latest addition is the director for the National Institute of Arthritis and Musculoskeletal Diseases. So arthritis is a big issue in many tribal communities. So it's really important for us to talk about the research and the clinical trials that are taking place that community members might want to participate in moving forward. So I talked about the communication part about it, but then I also want to talk a little bit more specifically about our policy here. And I talked about the NIH tribal consultation policy, and you can see here that this was an important policy document. So it wasn't just something that we developed on our own. You remember the NIH Tribal Advisory Committee that I had talked about? We engaged them they played a tremendous role in developing this policy. So they helped us develop this policy, but we also took this policy to national consultation. So many tribes provided input about what this policy looked like and would it be meaningful for their communities. And with everything that we received, we think that we have an extremely solid policy right now that, again, you can find this stuff on our website, but we feel like it really strengthens and respects tribal sovereignty. It has really been a vital tool for the agency to educate a lot of our research scientists about the importance of this process. It focuses on our issues specific to the NIH, but it also replaces that general guidance that I had mentioned earlier. And this slide just actually shows you that we've really had a great opportunity to put this into practice. So you can see all of the different consultations. So what we've been doing is that we've been refining our process each time we hold consultation. And these are this is a running list that's growing. And it's been terrific because a lot of communities have received and have learned a lot more about the NIH as a result of this form of communication, this enhanced form of communication. We've had more tribal leaders join our NIH Tribal Advisory Committee than we have ever had before. So the awareness is really really becoming evident, and it's really been a delight to us to see this. So you can see here that one of the things that we need to go back and visit is the opioid consultation that we had, the opioid crisis in Indian country, which was in 2018. As we began to put a lot of those interventions or those funding announcements into play, the pandemic broke out and it really set everything back. So it's time to go back into that. And actually, we've done that a little bit with one effort that I'm going to talk about more in detail here. And this is the most recent consultation that we've had. And just to give you a sense of the idea of how we do this is that we bring together the program leaders and we talk about the program, the overview of the program. Sometimes we hold recorded webinars that are available to tribal communities and tribal leaders after the fact. But we have an initial conversation with them to describe the ins and outs, because a lot of these programs, they're so complicated. You saw some of the presentations that are up here earlier. The people were just barely, our presenters were barely able to give you just a very superficial glimpse of what their programs are like. So this gives us an opportunity to describe in detail what these programs are like and where they might be able to benefit tribal communities. Then we hold the formal consultation where tribal leaders will come to the table and say, these are the things that we're seeing. Some of the things that we heard were around data. We don't have enough coordination and collaboration in our community. There's not enough data to provide accurate and real-time surveillance in our communities. The only way that we know if somebody's dealing with a substance misuse issue is if they're admitted to the hospital or they're incarcerated. How do we close that gap? And so these are really important things around prevention, that we're here having these discussions around today. So this is one of the most recent ones. Something that we're always actively engaged in as well are bringing up and fostering the development of the next generation of American Indian and Alaska Native scientists. And you can see here that when we had a really nice cohort coming to the NIH, they were over 30 of them came. And what we would do is we would spend time to take them down to the hills so that they would be able to meet their American Indian or Alaska Native representatives and have that conversation about how important research is to their communities. So here you can see that we took the group down. We met with the representative Sharice Davids. We met with Representative Tom Cole. We also met with Representative Deb Holland, who is now secretary. So these are really important efforts, but what we were trying to do is to make sure that we were continuing to build that pathway. And through the regional training hubs, we're thinking that we're going to do that. We'll have more students year by year wanting to come to the NIH through those training hub mechanisms, and we'll have spaces for them. So something else that we're also doing is developing different components into new research initiatives or programs at the NIH. The Common Fund is a very big program where a lot of institutes contribute funds to, and the Common Fund is charged with developing cross-cutting research initiatives that one IC wouldn't be able to tackle alone. And so here you can see that for the very first time, the Common Fund had a listening session with tribal communities where we heard from the communities about what are some of the social determinants of health that are restricting you from participating in research. And some of these, we heard some recommendations around, we don't have consistent funding for tribal IRBs. We don't have a process for reviewing grants and applications, which all I think goes back to tribal IRBs. So there was a tremendous amount of really valuable information that we heard that's going to help shape these new programs in a way that they've never had tribal voice input before. So something that I hear a lot of, and I've heard a lot today, and were fantastic points of discussion, is around data sharing and data management. So not only do we think about programs, but we also have to focus on the policies that support biomedical research. Some of them don't foster or lend themselves to want tribes to participate in research. They serve as barriers. Why do they serve as barriers? Well, because there are things in there that are not attractive, that impinge, or that the tribal communities feel like they're not respecting tribal sovereignty. So one of the things that we're doing is that during new policy development, this is a brand new data sharing and data management policy that will actually go live in the beginning of 2023, is that we held national consultation on this policy, received a tremendous amount of feedback. But from that consultation, we worked with our NIH subcommittee, our TAC subcommittee, and developed guidance around what are the considerations that researchers, that all of us in here should be thinking about when we receive funding from the NIH, when we want to include tribes in research. That's around data sharing, data management, access, reporting, publications. All of these things are captured in this guidance, which we are hoping to get out very soon. It has been released out to tribal leaders, and we're receiving academic input now. And I believe that window has closed now. So we're in the last stage of this process. But this has been a really important part of this policy process that of respecting sovereignty. But not only are we including tribes in the policy, in the deliberating process, but we're also thinking about new ways to actually respect tribal sovereignty and to have tribes manage their own research. This is a new funding initiative or a new effort that's out. It's called the Tribal Data Repository from the RADx Up program. This is a pilot program. It's the very first of its kind. And what we're hoping are that Native or tribal grantees will send in applications where they will begin to think about how they can set up their own repositories to collect and store and manage their own data. And this is so important because this has been a huge limiting factor for a lot of communities, because there has been limited oversight, there's been limited tribal participation at whatever stage of this data securing and management phase of a program, of a large program. And as we all know, these large data programs are a thing of the future. A lot of research is headed in that direction. There's a lot of utility in the large, in the power of numbers. If you have a conversation with Dr. Murray, he will always say that, right? Statistics are a key. And how we identify very small, minute differences or discrepancies in health are through large data sets and comparative analysis. So this is a way where we're trying to include more tribal communities to have benefit, to receive benefit from their participation in biomedical research. So not only that, but I had talked about this. This is a really important part of what our office has been doing and how we work with the tribal communities, is thinking about how we were able to incorporate culture into the science that we support. And this has been something that we have really done with intent and careful thinking. We met with traditional healers and we convened one of the largest gatherings of traditional healers from many different communities across the country and had a conversation about, do you think that Western science and traditional medicine and healing have a place together? And they all absolutely said, absolutely. We encourage our community members not to choose one or the other, but to use both as a synergistic way to heal our communities. And so this is something that has been a really important conversation. So if we include and culturally adapt research methods and approaches, more of the community members would be willing to participate and receive benefit from the biomedical research. So I think it's really important for us to take that into consideration as we think about having more tribes participate in research. And this is a report that's on our website as well, that if you want to read some of the things that were mentioned by the healers in this gathering, you can find that report on our website. So everything that I've talked about, you can see that it's been here, it's been there, it's been this way. It's been because we really think about a holistic approach to healing. And we've done a lot of things in many different areas. And you can see here that thinking more about the academic realm is that not only are we engaging communities and policy, but we're also thinking about how do we train and educate ethicists, the ethical side of conducting research with tribal communities. You can see here that we did a series on, this is Dr. Sarah Hall, who is the director of the bioethics core at the NIH, and she's doing a detail in our office right now. We've been working together on a lot of different efforts on how do we think about, how do we educate the scientific community, the internal scientific community, about the appropriate ways to engage tribal communities. We've also developed something that's called the critical considerations for reviewing American Indian and Alaska Native applications. And this has been really important because it's a resource for reviewers who come to the NIH to review applications to better understand what are some of the nuances related to tribal communities that they should be thinking about when they review these applications. There may be a slightly different approach to answering the same question, but that's because they're working in tribal communities that work and operate differently than other communities. So it's a really important document. And if you haven't seen it, I really recommend that you look at that. Some of the really cutting edge stuff, the really cool stuff that we're working on, that we're really excited about, and I know all of you in here are going to absolutely love to see this, is guidance on the ethical inclusion of urban Indian populations in biomedical research. This is such a huge challenge because there's 574 tribes, each have their own laws, rules, and regulations on research. And so how do we include those members that reside outside of tribal lands or outside of tribal jurisdictions ethically in biomedical research? You know, so there's so many nuances to this conversation, but I just wanted to let you know that this is coming out. We're hoping to get this out by Halloween. And we're working with American Indian and Alaska Native ethicists from across the country to help develop this document. And we'll see what the next steps are going to be after it gets drafted. But a really important effort and a long time coming as well. So some of the other things you can see here, there's the critical considerations document that I had mentioned that's for reviewers right in the center there. But we also are putting out more scientific commentaries, you know, for other individuals or researchers to review, to read about what are some of our perspectives in the office and how we're engaging tribal communities, some of the things that we've learned. So there's a building resource and literature on our website as well. But something that we always love to do and we enjoy this are bringing in different perspectives during the month of November. As all you all know that November is National Native American Heritage Month. And last year we were able to invite Dr. Don Warren, who really came in and gave a wonderful presentation about the interconnectedness between culture and science and talked about how culture has played a big role in how things are developed in tribal communities throughout the centuries. So if you go to this presentation, it's also recorded and stored on our website. You can see all of the different examples that he talked about, the rotation of the helix and how that translated into the building of structures in tribal communities, and the galaxies and the stars and how they are all very much in alignment with how the DNA helix winds out. So really, really wonderful presentation that you could find there. And we've also had Dr. Where is she at? Melissa, who was also an invited speaker to our event one of the prior years. So thinking about, I wanted to, as we get closer to the end of the presentation, I wanted to go over this diagram here that really showed how we engaged in the COVID-19 pandemic. And one of the things I would say is that there has been not even a more clear example about the importance of implementation, the need for implementation science than what we've seen from the our COVID-19 experience. We were able to really do everything, I think, as well as we possibly could to educate, to get everybody ready. Everybody was ready to receive the vaccine. And then when it came time to administer the vaccine, we had no idea how to do it. You know, and that is where the implementation part of this really comes into this. And so this kind of science is so important because we never know what's around the corner. And we have all seen that in a couple of years, 1 million people have died from this virus. So it's really important for us to become prepared, to prepare communities that have suffered the greatest from this pandemic, prepare them for whatever lies or for the next public health emergency. One of the great things that did come out of this process was working with tribal communities, that we were able to develop a novel data sharing and data management and biological specimens agreement with a tribal community and a pharmaceutical company. So this was a very clear indication that the pharmaceutical companies are very willing to negotiate and to partner with tribal communities. We just had to sit down and do this and together. And it was a very, very beneficial experience for all of us. So now we have several documents that are being shared amongst many tribal communities that are choosing to participate in clinical trials. Now they have a template document that really takes out a lot of the legwork for them so that they can customize it to their own community needs. So everything that I've been talking about, why has this been so important? Well, as you can see here, the office was started in 2015, and this is something from our research portfolio analysis that, as you can see, year by year, the investment for the agency is continuing to go up. And you can see that projected in 2023, we're almost going to be at 350 million. So we started at 180 million. And because of the portfolio analysis, because of the strategic plan, because of the education that we've been doing across the agency, and with all the different scientists around the country and with the communities, I think it's really paying off that the agency is increasing investment. And now we're hoping that some of these social determinants of health, some of the health disparities that have plagued tribal communities will begin to see results in the near future. These are not quick fixes. They are going to take time, but I think we're on a good path. So with that, I want to say thank you so much for your attention. And here is my contact information. If you have any questions about anything related to biomedical research at the NIH, I'd be happy to answer those. Thank you so much.
Thank you so much, Dr. Wilson. That was very informative. And after hearing everything that you've accomplished, I'm all the more grateful that you've traveled across the country to our conference and shared your learnings with us. Appreciate it.
Thank you so much. And this is just the tip of the iceberg. You know, we're just really beginning. I think that we're now really getting into some of the real challenging issues with tribal communities. And we had some of those discussions in an earlier session about the data. You know, how do we categorize data? Data comes in many different flavors. And our ultimate goal is to reduce any kind of stigmatization that might result from the release of data that's associated with tribal communities. But how do we determine what that is without reducing the benefit from the communities around the research that they've been participating in? How do we refine common data elements so that they're responsive to the research project, but they also give us enough information so that we're able to identify relatable or co-occurring issues or conditions, you know, with participants in clinical trial studies. So it's just a really nuanced conversation, but we're very interested in partnering with all of you out there on how to answer some of these really tough questions.
Thank you again. And we're going to have to wrap this up as we have our awards ceremony coming right up, but you've shared your slides with us and given people a lot to think about, and your contact information. We appreciate having that to follow up.
And I will be around, so wearing my mask.
Track him down.
Thanks so much.
Thank you.